Okay guys, so here we're going to talk about the muscles of the face, the neck, abdomen, as well as the back muscles. We're going to get up to identifying what they are, as well as what the actions are for them. We're going to start up top. Here we have the occipital frontalis, or epicranius. In the back here is the occipital belly. In the front, we have the frontal belly. Frontal belly helps with elevation of the eyebrow. Right here on the side, we have the temporal parietalis. Temporal parietalis is different and superficial to the temporalis. The temporal parietalis helps with moving of the ears. Temporalis, however, helps with mastification, which is elevation of the jaw. Very similar to the masseter, which also has to do with elevation of the jaw. Now, here we have a tendon that's called the epicranial aponeurosis. Moving on to the facial muscles now. We have two circular muscles, orbicularis oculi and orbicularis oris. Orbicularis oculi helps with squinting of the eyes or closing the eyes. Orbicularis oris helps with puckering of the lips, so like that. Here on top simply is nasalis, so like a wrinkling of the nose. Right here we have corrugator supercilii. They bring the medial parts of the eyebrows more medially, so that's going to be going like that. Next, below the orbicularis oris, orbicularis oculi, we have the zygomaticus major and minor. Minor is on top, major is on the bottom. These two are the zygomaticus. What they're going to help with is smiling. These are the smiling muscles. Okay? Right here you have the risorius. That draws the lateral corners of the mouth even more laterally. Okay? So zygomaticus is going to help with smiling. Risorius is just going to draw these laterally. So like that. Okay? Deep to the zygomaticus we have the levator labii superioris. That's going to help with elevating the upper lip. So simply like that. Okay? Then right here directly below orbicularis oris, we're going to have depressor labii inferioris. That's going to do the same thing but opposite as his brother on top. It does depression of the lower lip specifically, so like that. Next to that, we have depressor anguli oris. That's the frowning muscle. That draws the lateral lips, that lateral corner of the lips down. So like that. Okay? Moving on, right here we have the buccinator. Buccinator simply compresses the cheeks, holds the food inside your mouth. Okay? We went over the masseter, which has the same function as the temporalis, which is elevation of the jaw. Alright, so now we're going to move on to the sternocleidomastoid. We have the sternal head and the clavicular head. And it attaches, the insertion is the mastoid process of the skull. Now, when working together, bilateral, sternocleidomastoid does flexion of the neck. When it's working unilateral, it does lateral rotation, going like that, left and right. Okay? So together, when they contract together, we're doing flexion of the neck, and again, unilateral, we're doing rotation. Next, we're going to get to the throat muscles. We have from here, from the sternum to the hyoid bone, we have the sternohyoid. From the sternum to the thyroid, we have the sternothyroid. From the thyroid to the hyoid, we have the thyrohyoid. Now, all these muscles help with depression of the hyoid bone, and the sternothyroid helps with depression of the thyroid as well. Now, as you can see in the picture, we have also the digastric, which is the anterior and posterior belly. That helps with depression of the mandible, so opening the mouth. You also have the amohyoid, the superior and inferior belly. That's on the left of the picture. That helps with, again, depression of the hyoid bone. You can see the sternocleidomastoid is cut off. Deep to that is that amohyoid, as well as the sternohyoid. And like we said, sternohyoid helps with depression of the hyoid bone. On the right side, we have even deeper the sternothyroid. And again, that helps with depression of the thyroid. And then on top of that, we have the thyrohyoid, depression of the thyroid. We have the mylohyoid cut on top on the top right. That helps with, again, depression of the mandible, opening the mouth. Coming back here, we're getting to the abdominal and thoracic muscles. Here, the biggest one is the pectoralis major. Pectoralis major has 4 functions. First, it's shoulder flexion. Next, we're getting to shoulder abduction. Next is medial rotation of the shoulder. And then transverse or horizontal abduction. So four functions for the pectoralis major. Again, flexion of the shoulder, abduction of the shoulder, medial rotation, and horizontal or transverse abduction for the pec major. Covering all these neck muscles, forgot to mention, was the platysma. That would cover all of that. When you go like this, that's your platysma working. Okay? It's making your neck wrinkle like that. Okay? So that's the platysma. Covers everything here. Okay. Moving on from the pectoralis major and platysma, we have the pec minor. Pectoralis minor is deep to the pectoralis major. Okay, remember, all the muscles on this side are deep to all the muscles on this side. So, pectoralis major helps with protraction of the scapula. So scapula in the back, the bone in the back, it's usually like this at anatomical position. When we're using the pec minor, it's moving on like that. That's protraction or abduction of the scapula. Either or should be fine. So it's going like that. Okay? So pec minor helps with that. Here we have the anterior scalenes on the side. Right here. Anterior scalenes. Same function as the pectoralis minor, which is protraction or abduction of the scapula. So those two, same function. Here you have this line separates the internal and external intercostals. Internal intercostals help with expiration. External intercostals help with inspiration. So you can see the IE and EI in the beginning of the names. That's that. Also with having to do with inspiration, expiration are the anterior, middle, and posterior scalenes. The first two, anterior, middle, are attached to the first rib. Posterior is attached to the second rib. During inspiration, both ribs are elevated by the scalenes. Okay? So, moving down, we have the rectus abdominis, the muscles here. Those are your abs. And the tendon is the linea alba, right in between. Rectus abdominis helps with trunk flexion. So when you're doing crunches or sit-ups, trunk flexion is what you're doing. That's here. Next, the most superficial muscle on the side here would be the external oblique. Deep to that is the internal oblique. For the external oblique, the fibers run down this way, from top to bottom, going from lateral to medial. Internal oblique is the opposite. It's from top to bottom, it's going medial to lateral. Transverse oblique is even deeper to internal oblique. That's just going like that. Okay? External, internal oblique help with rotation as well as lateral flexion. Okay? Transverse oblique compresses all the organs, and to work the transverse oblique out, you can do planking, is one of the moves. So, with that out of the way, serratus anterior we've said before. Now, we're quickly going to get a glimpse of the deltoid here. We're going to go over that in the arm video. But the deltoid has also technically 3 muscles: anterior, middle, and posterior deltoid. Anterior, let's start with the middle actually. Middle deltoid is the prime mover for shoulder abduction. Okay, remember, abduction is moving away from the body. Adduction starts with ADD. You're moving it towards the body. You're moving the limb, adding the limb towards the body. Okay? So, middle deltoid, prime mover for abduction. Now, anterior, posterior deltoid, they have 2 functions each, and they're complete opposites. So if you know one, you can know the other. Anterior deltoid helps with flexion of the shoulder, as well as medial rotation. Now, posterior deltoid helps with extension of the shoulder and lateral rotation. So, altogether, 5 movements, okay? These two have two movements that are opposites. This one is prime mover for abduction. So that's that. We're also going to go over that again when we get to the arm. Now, making sure everything's done here, we're moving on to the back. Here, a bigger muscle, the one that we see first, trapezius. Again, much like the deltoid, we have three different muscles here. Upper, middle, lower trapezius. All are considered the trapezius. Upper trapezius helps with upward rotation of the scapula. Now, when you're moving your arm, when you're doing abduction of the arm, that's your humerus working in the glenoid cavity, okay? Up to right here is the glenoid cavity working and the humerus. From here up to you raising your hand, that's the scapula moving. The humerus is no longer in play. That rotator's cuff, that glenoid cavity is no longer in play. So here is the scapula moving. We did protraction of the scapula, which was like that. Scapula moving from anatomical position, protracting. Now when we do upward rotation, the scapulas are moving up, simply like that, okay? So when I'm picking my hand up from here to up raising my hand, that would be the scapula moving like that. That's what the upper trapezius does, as well as the lower trapezius. They both are synergists when it comes to upward rotation of the scapula. Now, upper trapezius also does elevation of the scapula, so that's shrugs, like that. So when you're doing this, that's upper trapezius. Lower trapezius is the opposite. When you're going up, we need to go down, so that's lower trapezius depressing the scapula. So they're antagonists when it comes to elevation and depression of the scapula, but they're synergists, so they work together when it comes to upward rotation of the scapula, okay? Now, we did protraction, which is pec minor and serratus anterior of the scapula, going like that. Middle trapezius helps with retraction, bringing the scapula back to anatomical position. So retraction or adduction of the scapula, either or is fine, going back. Now, trapezius is done. Getting to this big muscle here, latissimus dorsi. I call it the selfish muscle. Latissimus dorsi brings the arm closer to itself in every single possible way it can. So, going from this position, it does extension, bringing it back to the latissimus dorsi. Okay? From this position, doing adduction, again, back to the latissimus dorsi. And even closer, doing medial rotation. All movements are bringing the arm closer to the muscle. That's why I call it the selfish muscle. It wants the arm all to itself at all times. Now, moving on to this side. These muscles are superficial to these muscles. So when we take all of this off, we'll have these. Starting on top, we have the splenius capitis right there. Okay? That simply does extension of the neck. Okay? Extension of the head. Now we know that sternocleidomastoid bilaterally working together does flexion. So this is an antagonist doing extension and hyperextension of the neck. Okay? Moving on here, you have the levator scapula. Simply it's attaching to the top of the scapula. It's easy to identify. Levator scapula. This is very simply elevation of scapula. Okay? It's in the name of that one. These two are the rhomboid brothers. You have the rhomboid minor and the rhomboid major. Much like the middle trapezius, they do retraction or adduction of the scapula. So they're synergists to the middle trapezius when it comes to retraction, adduction of the scapula. But we said earlier that upper and lower trapezius does upward rotation of the scapula. You see that the fibers of the rhomboids connect to the bottom of the scapula. That's going to be doing downward rotation. So when it comes to retraction of the scapula, they're synergists to the middle trapezius. When it comes to downward rotation and upward rotation, trapezius does upward, rhomboids do downward rotation. They're antagonists when it comes to that muscle function. Okay? So rhomboids minor, major, retraction or adduction of the scapula, as well as downward rotation of the scapula. And again, downward rotation is simply going from here, where you have your hand up, down like that. Okay? Again, up here is the scapula right now, and is going down. Okay? Now, moving on to, you can kind of see the erector spinae group here. Closest muscle to the closest muscle here would be the spinalis. Next to that would be longissimus, and then iliocostalis. So remember, you have 3 muscles in that erector spinae group. You need to remember the groups as well as the muscles that make up the group. That's very important. They simply, like it says in the name, keep your back erect, so you don't have that hunchback. Okay? They keep your back erect. That's that. Next, we're going to get to, this is the scapula, as you can see, the spine of the scapula. On top, you have the supraspinatus. On the bottom, infraspinatus. Now, it's the same as the fossa that we did on the scapula. Supraspinatus fossa, infraspinatus fossas were here, right? Now you have the supraspinatus muscle and infraspinatus muscle. They do not have the same function now. Supraspinatus muscle aids in the middle deltoid, being a synergist to abduction of the shoulder. Infraspinatus and teres minor do the same thing. They're synergists to lateral rotation. Okay? So, synergists to lateral rotation, but then they'll be antagonists to, let's say, pectoralis major or latissimus dorsi when it comes to medial rotation. So both of them work together for lateral rotation. But when it comes to being an antagonist, pec minor and latissimus dorsi are examples of them being antagonists. Okay? Here, again, teres minor, on the bottom is teres major. Now, a little break is teres major has the exact same functions as latissimus dorsi. That's why you're going to see your professor saying it's called the little lat, or you've probably heard that before. So teres major, exact same thing as latissimus dorsi. Extension of the shoulder, abduction of the shoulder, medial rotation of the shoulder. Okay? So those functions are exactly the same. Teres minor, infraspinatus, helps with lateral lateral rotation, and supraspinatus aids and is a synergist to middle deltoid when it comes to shoulder abduction. Now, very quickly here, you're going to see the gluteus maximus. Your professors might ask for this on these models as well. So, on top here, you see the gluteus medius. We'll get to the functions in a different when we get to the actual lower extremity. Gluteus maximus is the bigger portion. Gluteus medius is directly deep to that. Gluteus minimus, we would have to take medius out, and you would see minimus in there. Directly below gluteus minimus is piriformis. Okay? So you need to know both of those muscles. Okay. So, one more thing in the front here. Again, this is going to be seen in the lower extremity model, but you could see it here as well. Right here, the longest muscle on the body, sartorius. Okay? That's right there. Here you can see the rectus femoris, part of the quadriceps. Going from here, rectus femoris, then you have iliopsoas, which is the combination muscle of iliacus and psoas major. Now, medial to these blood vessels, you have pectineus. Okay? You can remember him as peaking pectineus. He's coming out of the blood vessels a little bit. And right here, you'll have adductor longus. Okay? Again, all these muscles are going to be shown as well as the functions are going to be told in the lower extremity video. Now, as you can see in this picture, we have two more muscles that we didn't speak about. The multifidus and quadratus lumborum. Multifidus being medial to quadratus lumborum. Both quadratus lumborum attaching to the transverse processes of the lumbar vertebrae. Multifidus attaching to the thoracic as well. Now, both of them help with lateral flexion of the back. Okay? And in this picture also you can see that erector spinae group. Okay? You can see the erector spinae muscles. Iliocostalis all the way lateral, longissimus in the middle, and spinalis, the most medial muscle. Okay? That keeps your back erect. Okay? In this next picture, we can see the iliopsoas. Okay? We mentioned the iliopsoas that you can see it in the model, but you can't see them separate. You cannot see them separately. So you see the psoas major on top, on the medial end, and the iliacus on the actual pelvis. And when they join on the bottom, right next to where it says arbitrator internus, that will be the iliopsoas.